Which of the following are true of the nephron or its part? Sodium is actively transported by its cells and it is found in the pars convoluta, pars radiata, and medulla. Good collateral circulation occurs in skin. Sinuses are not seen in none because sinuses are seen in kidney, spleen, endocrine gland, and liver. Which is not a feature of skeletal muscle? Spindle shaped fiber and hypolemmal nucleus. So, what is the feature of skeletal muscle? Striation and syncytium. Epithelium of cornea is stratified squamous non keratinized. Epithelial lining of the tonsil is squamous epithelium without keratinization. Hessel's corpuscle are seen in thymus. Which of the following is lined by transitional epithelium? Urethrovesical junction. Uretrovesical junction. Urethrovesical junction. Ansa nephroni is lined by cuboidal and squamous. Toughest layer in esophagus is muscularis. Parietal peritoneum is lined by simple squamous. Brunner's gland are located in the duodenum. The normal process by which the existing epithelial cell of the skin are replaced by new epithelial cell is called apoptosis. Space of Dissay is seen in liver. Olfactory epithelium is pseudostratified. All have no lymphatic except dermis. So, brain, internal ear, and eye does not have lymphatic, but skin have lymphatic. Halocrine secretion is seen in sebaceous gland. Largest organelle in eukaryote is endoplasmic reticulum. The commonest cartilage to ossify is fibroelastic. Stellate cell of von Kupffer are seen in the sinusoid of which organ? Liver. Gitter cell are microglia. Intercalated disc is present in cardiac muscle. Number of cartilages in bronchiole is none of these. Nissel's substance is mainly ribonucleoprotein. Elastic cartilage is found in auditory tube. The synovial bursa between an aponeurosis and a bone is called subfacial. The following structure do not have lymphatic except bone marrow and cartilages. So, does not have lymphatic except, so bronchi and epidermis does not have uh, bronchi and epidermis have lymphatic drainage, but bone marrow and cartilages does not have lymphatics. The following gland contain the myoepithelial cell except sebaceous gland. So mammary gland and salivary gland and sweat gland have the myoepithelial cell. Goblet cell are present in trachea. All of the following physiological processes occur during the growth at epiphyseal plate except replacement of red bone marrow with yellow marrow. So which physiological process occur during the growth at the epiphyseal plate? Proliferation and hypertrophy, calcification and ossification, vasculogenesis and erosion. Ceruminous glands present in the ear are modified apocrine gland. Neuroepithelium type of sensory receptor are present in the following system except visual, auditory and olfactory. So neuroepithelium type of sensory receptor are present in gustatory system. The duct of all the following gland consist of stratified cuboidal epithelium except sebaceous gland. So duct of which gland consists of stratified cuboidal epithelium? Sweat gland, salivary gland and pancreas. Von Braun's nest is seen in normal urothelium. Cell which does not migrate from the base of the crypt to end of villi is Paneth cell. The upper half of the esophagus is lined by stratified squamous non-keratinized epithelium. Almost exclusively urinary bladder is lined by transitional epithelium. A patient presented with acute abdominal pain. On clinical suspicion, the patient underwent cholecystectomy. On histopathological examination, the finding is normal. The gallbladder epithelium will be simple columnar with brush border. Uroepithelium lines all except collecting duct. So urothelium lines ureter, minor calyx and urinary bladder. The epithelial lining of the urethra below the opening of the ejaculatory duct is stratified columnar epithelium. Tonsil is lined by stratified squamous non-keratinized epithelium. Ureter is lined by transitional epithelium, which is not lined by stratified non-keratinized squamous epithelium. Tympanic membrane is not lined by stratified non-keratinized squamous epithelium. What is lined? Hypopharynx and laryngopharynx, esophagus and cornea. About osteon, which of the following statement is correct? It is present in compact bone, concentric lamella is present, and Haversian canal is present. Cell present in cerebellar cortex are all except bipolar. So Purkinje, granule and Golgi cells are present in the cerebellar cortex. Gut associated lymphoid tissue GALT is primarily located in the lamina propria. Urothelium lines all except membranous urethra. It lines ureter, minor calyx, and urinary bladder. Ruffled membrane is seen in osteoclast. After ovulation, the discharged oocyte and surrounding layer of granulosa cell are known as corona radiata. Urothelium line all except membranous urethra. It lines ureter, major calyx, and urinary bladder. Paneth cell true is rich in rough endoplasmic reticulum, high zinc content, and numerous lysozyme granules. Human intestinal gland contain Paneth cell, neuroendocrine cell, and stem cells. Portal acinus in liver is centered on one hepatic arteriole. Which of the following is a holocrine gland, sebaceous gland? Transitional epithelium is seen in urinary bladder. Lining epithelium of vagina is non-keratinized stratified squamous epithelium. Lining epithelium of fallopian tube is ciliated columnar. Lining epithelium of the uterine cavity is ciliated columnar epithelium. Mucous gland are absent in duodenum. All are derived from ectoderm except Clara cells are present in bronchioles. Trachea is lined by pseudostratified columnar epithelium. Transitional epithelium is present in renal pelvis. Which of the following cell will proliferate from top to bottom of villi? Paneth cell. Multi-unit smooth muscle present at all except gut. So multi-unit smooth muscle present at blood vessel, iris, and ductus deferens. Which of the following is an example of holocrine gland? Sebaceous gland. All cartilage is covered by perichondrium except fibrocartilage. So which cartilage is covered by perichondrium? Hyaline elastic. Which of the following is not a hyaline cartilage? Meniscus. Glands of van Ebner are present in tongue. Brunner gland are seen in duodenum. Stave cells are seen in spleen. Corpora amylaceae is found in prostate. All are developed from endodermal cloaca except sigmoid. So what is developed from endodermal cloaca? Rectum, anal canal, and primitive urogenital sinus. All develop from mesoderm except enamel. What develops from mesoderm? Skeletal muscle, testis, and ureter. Holocrine glands are sebaceous. Stratified squamous epithelium is seen in vagina. Which of the following is a part of ear derived from all three germ layer? Tympanic membrane. Colon contains goblet cell. False about clavicle is most common site of fracture is the junction of medial 1/3 with lateral 2/3. True is it ossifies in membrane, horizontal bone, and no medullary cavity. Now joints. The example of syndesmosis type of joint is inferior tibiofibular, which is a hinge joint, elbow. Action of lumbrical is flexion of metacarpal joint and extension at interphalangeal joint. It can be said that the intervertebral foramen admits spinal arteries. Os trigonum is which type of epiphysis? Atavistic. Following examples of epiphysis are correctly matched except aberrant epiphysis with trochanter of femur. So which are correct? Pressure epiphysis, head of femur. Traction epiphysis, tubercle of humerus. Atavistic epiphysis, coracoid process of scapula. Manubriosternal joint is a symphysis type of joint. Which of the following is an example of saddle joint? Carpometacarpal joint of thumb. Example for ellipsoid joint is wrist. All of the following are example of traction epiphysis except condyle of tibia. So which are traction epiphysis? Mastoid process, tubercle of humerus, and trochanter of femur. In interphalangeal joint, capsule is absent in dorsal side. The first costochondral joint is a syndesmosis. Vomer sphenoidal rostrum junction is skindialysis. Skindialysis. Joint between epiphysis and diaphysis of a long bone is a type of synchondrosis. Example of hinge joint are all except shoulder joint. So, which are the examples of hinge joint? Elbow joint, knee joint, and interphalangeal joint. The type of joint between the sacrum and the coccyx is a symphysis. Which of the following is an intra-articular tendon? Popliteus. First carpometacarpal joint is a saddle joint. Movement of pronation and supination occurs in all of the following joint except radiocarpal joint. So movement of pronation and supination occurs at superior radioulnar joint, middle radioulnar joint and inferior radioulnar joint. Secondary cartilaginous joint are situated in midline, permanent in nature, and binding cartilage is fibrocartilage. Which of the following is an example of saddle joint? Carpometacarpal joint of the thumb. Carpometacarpal joint of thumb is a saddle type of joint. Enchondral ossification is seen in long bone. All of the following are pneumatic bone except mandible. So which are the pneumatic bones? Frontal, ethmoid and maxilla. Which of the following best describes the type of joint seen in the growth plate? Primary cartilaginous. True about location of metaphysis is epiphyseal end. What kind of a joint is syndesmosis? Fibrous. Which of the following is a compound condylar joint? Knee. Intercapsular articular disc is present in which joint? Sternoclavicular joint. Types of cartilage seen at temporomandibular joint is fibrocartilage. Which of the following is an example of atavistic epiphysis? Coracoid process of scapula. Which of the following is a synovial joint of the condylar variety? Metacarpophalangeal joint. Joint with articular disc is sternoclavicular. Elastic cartilage is seen in epiglottis. Flexion extension in neck occurs at atlanto-occipital joint. Now, which of the following is not a congenital anomaly? Mastitis is not a congenital anomaly. What is congenital? Emastia, polymastia, and polythalia. Parasympathetic supply is from S2, S3, S4. Prolapse of vertebral disc between L5 and S1 will affect which nerve root? S1. Subcapsular sinus is seen in lymph node. Absence of lymph node is characteristic of brain. Which of the following is an operculated sulcus? Lunate. Which of the following is a complete sulcus? Collateral. Then longest muscle in the body is sartorius. Corpora arbacea is seen in pineal. And which of the following is supplied by two nerves? Digastric.